everybody, and welcome to another Heart for PCOS interview. I am so excited to be sitting down to chat with a very special guest, Hannah Stoner, the PCOS lifestyle coach. When Hannah was diagnosed with PCOS at the age of 15, she didn't have anywhere or anyone to turn to for help or support. Since she started studying nutrition, lifestyle, and fitness, she has made it her mission to support women like herself who have struggled with this condition. So welcome, Hannah. Thank you so much for joining me today.
Thank you for having me. It's awesome to be here.
Absolutely. I would love you to learn a little more about your journey with PCOS and how it led you to become a lifestyle coach.
Yeah, so obviously, as you mentioned in the introduction, when I was diagnosed at the age of like 15 or 16, I went through 2 or 3 years of lots of tests and investigation and was pretty much just left on my own. Obviously, this was quite a while ago now. And I remember dealing with it. Like, my mum was amazing. She was so supportive, and she was like looking at like forums and stuff, but there just wasn't anything out there. So I was literally just left on my own to kind of deal with it and research myself. Obviously, at that age, I wasn't really too bothered about them saying, "Oh, you might not be able to have children," because it wasn't like even on my wavelength. But anyway, a couple of years, probably about 5 or 6 years later, I went through a really bad patch of just being really unwell. I was having a lot of time off school. I couldn't really function. I was gaining a lot of weight. Anyway, I was then referred back to specialists. I was basically told that you need to lose weight in order for us to be able to help you. So naturally, I kind of did what I was asked and told to do. Finally, I was had surgery, and then literally as I was in the recovery room, the doctor or nurse or whoever it was came over to me and just said, "There's nothing wrong with you. There's nothing else we can do." And I was literally like, that was the last conversation that I had with had with a medical professional, and that was about 6 or 7 years ago. So basically, from that time onwards, I've made it my mission to help women in not necessarily the same situation, but to prevent them having to go through that process. Because I remember coming home and feeling so lost, so confused, and I was like, well, I have all these symptoms and I feel so rubbish, but yet no one is going to help me. So yeah, it's basically from that point onwards, I was like, right, this is what I'm going to do. So I've kind of used that as my passion and motive to keep going.
Yeah, and I think that's kind of what spurs a lot of us to really start speaking up and advocating. That unfortunately, unless somebody specializes in PCOS or has really researched the condition, when you go to seek answers or get medical care for PCOS, you often feel like you're dismissed, or they'll give you a diagnosis and send you on your way and give you some pills or say, come back and see me if you want to get pregnant. Well, what happens outside of that, right?
Exactly.
So I guess one of the things that I wanted to ask about that kind of dovetails from that is,
Mm-hmm.
how does lifestyle impact PCOS, and why is it important to kind of listen to ourselves and our bodies when dealing with PCOS?
Yeah, 100%. That was actually one of the points that I was going to raise, is that the doctors, obviously I'm in the UK, you're in the US, and I know it's the same for both of us, but doctors are so fixated on the weight and like BMI side of PCOS that they don't really care to look at all the other factors that affect us. I actually had a client in the last couple of months who went to her doctor with these or list of specific symptoms, and he just brushed her off and said, well, I've never heard of that before, and it's all to do with your ovaries. So it's areas like our sleep, our environment, our stress, our nutrition, our exercise, supplements, all that sort of stuff is so important when it comes to managing and looking after our diagnosis. So it's just so much more than like a weight centric thing. I know, especially in the UK, the way in which like the NHS measure is all to do with numbers and like metrics. So it's kind of no wonder that it's just all about weight and BMI, but it's creating this awareness and creating this advocacy to try and make them understand or make them do more research, and finding just one doctor that is willing to go down that process or go down that route of being like, do you know what, actually no, I understand, this is what we're going to do. It's very few and far between.
Yeah. So let me ask you a a question that's kind of built into this because we were talking about BMI and metrics and everything. Why is it important, do you think, and do you practice health at every size?
Well, when I have an initial consultation with someone, I don't ask their weight, I don't ask their metrics. I basically, the information that I want to know is what they have done that's worked for them, what they've tried that hasn't worked for them, because that kind of gives me an avenue of, where to, like, an initial starting point. Because when someone comes to you and they're like, oh, I've got irregular periods, I'm overweight, my cravings are all over the place, I've got hirsutism, I've got this, and this. It's like, well, which avenue is best to go down? But, one thing that I was going to mention is having an overall analysis of our lifestyle. So, like we said, it's important to know what they have and haven't done, but it's also important to know what their nutrition currently looks like. And that's room for like an open conversation. So, people need to be able to feel like they're not being judged or not going to be framed for, having a burger at the weekend and like feeling guilty about it. So, and I think that very much as well comes into, like you mentioned, treating people as any size, because size shouldn't matter when it comes to medical advice or medical treatment. But as soon as you walk into the doctor's office, I'm presuming it's probably the same for you in the US as well, as soon as you walk into that doctor's office and they see you for what you are and your shape or size, they'll instantly treat it as, well, I can't treat you until you lose weight, or I can't treat you until you get your BMI down. Whereas it's not like that when you work with someone like myself, because I see both sides of it. I've been in that position, and I've been on both sides basically. I've been in the smaller body and I've been in the bigger body, and it's important that we treat everyone fairly.
Absolutely. And I did want to mention, because when I talk about health at every size, people assume that I'm just talking about people who are overweight who are being judged. But also, there are a lot of patients with PCOS who are thin, and they also get dismissed because doctors say you can't have PCOS, you're thin. There's no way. So PCOS affects us any shape, any size, any age, and we have to recognize that in treating patients. So I know we talked a little bit about what you go through with the patient when they come in as far as figuring out the goals. So what are some of the first steps that you can take in designing a care plan with them once they decide what their goals are?
Yes. So obviously, as I mentioned, we analyze what has and hasn't worked for them in the past. This covers their nutritional habits, their current lifestyle. I mean, if there's someone that is sat at their desk from 9 to 5, then my advice for them is going to be very different to someone who is on their feet 24/7. So not 24/7, but during the day. So it really depends on that. It also allows for knowing what their current exercise plan is, what their sleep habits are. If there's someone with a young child and they only sleep for 3 or 4 hours a night, then that's going to impact their results. That's going to impact their PCOS. So all these little details, it's important to know. It's also important to know like their current energy levels, all their symptoms. But it's also important as well that we don't overstep the mark with scope of practice and everything else like that. So yes, I need to know a little bit about their medical history, how they've been treated, what their current sort of medical plan looks like. 9 times out of 10, it is a case of I haven't seen my doctor for 2 or 3 years because they haven't paid attention. But if they're going through fertility, whatever, it's accumulating all of this information, and then it's putting it into a plan that is sustainable and that works for them, that it can be able to fit into a lifestyle. So no foods are off limit, no restrictions, there's no set you have to exercise 4 or 5 times a week and it has to be on a Monday, Tuesday, whatever day. It's all completely flexible. And we'll go on to talk about this further on, I think, but it's so important that everything is sustainable for them, because if it's not sustainable, then it's not going to work.
One of the things many people with PCOS talk about is not having a lifestyle plan that they feel is easy or enjoyable to follow. So I would like to talk a little bit about sustainability, why it's important and why it needs to be individualized.
100%. I mean, something that I see a lot in the PCOS space is that there are a lot of people who speak a lot of truth and, you know, have a lot of sense to them and everything. And there's nothing wrong with what they're teaching, but the way in which they're doing it is it's not sustainable, and it's also making it too complicated for people. So, you know, this isn't me saying that PCOS is easy, because we know 100% that it's not, but it's a lifelong condition that has no cure, and it needs to be treated in that sense, rather than being treated as something that's like, oh, cut out XYZ for 3 months and you'll feel better. Because as soon as you cut something out, you then start wanting it and craving it. So the way in which that I deal with patients is that we don't overcomplicate things, we don't cause any restriction, rather we create something that is sustainable for them. I kind of go by the motto of reduce rather than restrict, because that seems, you know, to make a lot more sense to people, to tell them that, okay, you can have a slice of pizza, or you can have a pizza at the weekend, but let's try not make it every day. Or, you know, you can have some chocolate, but, you know, let's allow it within its limits, rather than, you know, creating, you know, a binge or overeating or whatever it might be. So I think it's super important to be able to create something that is realistic and doesn't feel like, oh my goodness, I have to cut this and I can't do that, because as soon as you do that, that's when problems occur.
Totally agree with that. Because I feel a lot of times when I am getting information from a provider, they're kind of throwing it at me as opposed to helping me work through it and figure it out. So you deal with many different aspects of lifestyle and health as a coach. So, and I'd like to break this down a little bit and talk about the goal of each, because I'm not sure that people really understand the different components of lifestyle. So let's start with nutrition. Many patients with PCOS are mostly confused about the types of foods they should eat, when they should eat, how much they should eat, and the impact that it's having on their health. Can you talk about the importance of nutrition in a PCOS care plan?
Yeah, 100%. So I can't remember if I've mentioned this already, but in the kind of like health and wellness or fitness or whatever space, there's this saying that it's like 80% in what goes on in the kitchen and 20% what goes on in the gym is obviously hell. And that's fairly true still when it comes to PCOS, because nutrition is still fundamentally the key element of, you know, managing and controlling your symptoms. And we still live in a world where people think that if I go to the gym 5 times a week, or I exercise every single day, of course you're going to see results. And that is true. But if they're then going home and they're not eating the right foods, or they're not getting enough sleep, or, you know, they're just generally still feeling rubbish, then that's not going to be able to, you know, help them in the long run. And that's no different really when it comes to PCOS. So I think, as we've mentioned, there is so much confusion and misinformation out there. And I just kind of feel like it's really unnecessary, because it does overcomplicate things and makes people think, well, one person's saying this, one person's saying that, Google's saying this, like, what do I do? So I think it's really important to reiterate and keep the message simple. And like I said before, that's not because PCOS is simple or easy to deal with. It's not. But I think one thing that I'm very passionate about, and I'm an evidence-based, you know, coach. I believe, and I will look at the research, I'll look at the studies to show us. And I think that's important to reiterate when it comes to, you know, gluten-free diet, for example. A lot of people say that you need to cut it out to improve symptoms, lose weight and everything else like that, but the evidence just isn't there. Obviously, if someone wants to do that and they're celiac, then for that reason I obviously support them and guide them with that, but I would never prescribe them and say, oh, you need to do this, you need to cut this out, or anything else like that, because there's nothing to support or back up that statement. So, you know, it really is based around, you know, what works for them. and being able to create that lifestyle change, because I'm a big advocate. I've cut out lots and lots of things, and I've lost a lot of weight, and then I've also gained it back as well from, not from solely thinking of it as a weight loss goal, rather changing your mindset to think that, okay, I have this condition that I need to be able to manage and control through lifestyle choices, and I can't do that if I can't go out and eat dinner with my friends, or I can't go and see my family, or I have to take my little sandwich box or whatever with me. It's just not sustainable, and it needs to be 100%.
Absolutely. So I know we've been kind of teasing a little bit about this next topic, and I want to dive in a little bit more because I think it's so important. That a lot of times when we are online, we see a lot of information about restrictive eating and what we need to cut out with PCOS. However, we are learning that nutrition for PCOS is less about restricting and more about nurturing with the right foods, which is what you've been talking about. So can you dive in a little bit more about ways we should be nurturing our bodies with PCOS and kind of tuning out those messages that, as you say, complicate things?
It's something that definitely is a mindset thing that needs to be shifted, because especially in the UK, we have a lot of kind of diet groups and things, and the majority of people that I speak to, I would say at least 60 to 70% of those patients have done these dieting practices in the past, and they're led to believe that that there's free foods and there's sins and there's all these other things, which really has a knock-on relationship and effect to your mindset of how you treat foods. So when it comes to the weekend, for example, and they're going out with their partner, they then start feeling guilty or feel bad that they've eaten foods that aren't necessarily on their plan. So ways in which that I do that is, it's also like a bit about mindset coaching as well, and helping them understand and nurture their bodies with the food in which they're eating. So one way in which I'd actually do this with my clients is help them understand and listen to their body's cues and the way in which it almost tells them if the food that they're enjoying is good for them or not. And it is, like I said, it is a mindset thing that you have to kind of work on, because you can often get yourself into thinking, oh, this food's good for me and this food is bad for me, when really there are no good and bad foods. It's just the way in which our bodies use it for energy or whatever else it might be. So I think that's really, really important to allow people to make their own choices when it comes to food. If they want to have a bit of chocolate, if they want to have a pizza, have it and enjoy it, but don't feel guilty about it. And if it does make you feel really rubbish for the next couple of days, then remind yourself of that the next time you want to try and have it. Or we can always look at ways of making an alternative, something that's less fatty or, less carbohydrates, or just makes them feel better rather than them having that sluggish, awful, guilty feeling after. So I think it's, nurturing is about, it's a kind of like a double edge. It's a mindset thing, but it's also helping them understand that they can still have the foods they want and not to feel restricted when they're having them, or not to feel guilty when they're having them.
Right. Okay. So you and I were talking a little bit about some of the foods that are kind of controversial with PCOS. And I would really like to get your opinion on things like gluten and dairy, because I think that kind of goes along with this whole conversation that we're having about restrictive eating and what foods you can have and can't have.
Yeah. So I touched on it earlier, obviously, with the whole gluten-free debate that we see online. Some people say you shouldn't have it. Some people say that it's totally fine. My stance on it, as I mentioned, is obviously I'm an evidence-based coach. I'm actually studying to be an evidence-based nutritionist, so it would be against my scope of practice to say that, oh yeah, like cut it out if you want to, because there really is just no evidence that shows or supports that gluten-free needs to be cut out. There's one constraint, obviously, that's if you are celiac. then obviously gluten is something that you should avoid altogether. I think the confusion arises with the gluten-free thing is that the evidence and the research that has been done, it was based around a low carb diet, and naturally low carbs have less gluten in. So as soon as you remove a diet that's got more FODMAPs in, then you're going to feel better, your energy is going to improve, and more than likely, as long as you're in an energy balance, you're going to see weight loss. However, it wasn't specific gluten-free foods, it was just low FODMAP foods, which naturally are low in gluten anyway. So I think that's where the main confusion has come from with that. Dairy, I'm a little bit more open-minded, I guess, with it. From the research that I've done myself, and what I believe is you're better off having full fat dairy, because it's more about the sugar that's been extracted from it, so the lactose that's been taken out. So that generally tends to have effect on skin and acne is the only evidence that I've actually seen. And I'm more than happy to share research papers or whatever if anyone is interested in reading them. But that's my kind of stance on it. Obviously, if any clients come to me and they have a query on anything, I'm more than happy to research it and spend time, share them the papers or share them the conclusion to help them, ultimately make up their own decision on what they do and don't want to do. But I'm never going to tell a client to cut anything out unless it's specifically for them or based on a medical condition or whatever it might be.
Awesome. Thank you so much for that. I love getting opinions, because I think people need to hear different opinions to kind of form their own opinions on what may or may not work for them. And it's good for them to know that there are varying opinions, and that nothing is off the table. It's just how it makes you feel.
Yep,
so
100%.
Another thing I wanted to talk about is exercise and fitness. Exercise can help to manage symptoms with PCOS significantly, and even improve inflammation and help manage hormone levels. However, many think to do this, we have to be in the gym every single day going hard. Do we always have to be hardcore with exercise, or is it more about getting the body moving with PCOS?
Yeah, 100% not. I mean, I think, again, this is a common debate that's like, oh, if you have PCOS, you can't do high intensity training, which just isn't the case. Again, it very much depends on an individual. What I say to my clients is, one, is it depends on their current lifestyle. So if they can only spare 15 to 20 minutes to exercise a day, then there's no point giving them a gym workout that includes a 5-minute warm-up, a 5-minute cool down, and then 10 minutes on 2 resistance machines, because it's not going to feel effective. And that's where doing something that's a little bit more high intensity will, one, give them those endorphins, make them feel like they've had a good workout, but it's also important that they don't have that after effect of feeling sluggish and their energy levels drop. I think in this sense, and this is probably where the confusion comes, is when you exercise with high intensity, it can cause a slight increase in your cortisol levels to raise. However, it's not to the extent that people actually think it is. It's not a dangerous rise in cortisol, it's just a natural rise. And then it comes back down within a couple of hours. So again, it's about that balance. It's finding exercise that's enjoyable. If you're not enjoying the exercise that you're programmed to do, then you're not going to do it. And it's also something that's got to be able to fit into your lifestyle and be completely flexible. So if someone enjoys gym classes, if someone enjoys following on a YouTube workout, or if someone has their own home weights, it's based around whatever they enjoy and whatever they're going to get most satisfaction and enjoyment out of, and make them feel good at the end of the day.
Can you also talk about the role of exercise in helping reduce androgen excess and increasing insulin sensitivity?
100%. So as we know, exercise has huge benefits on those things. So but again, where the common misconception is that people feel like they have to do a lot of it to be able to see those benefits, and that's just not true. So even walking daily, swimming, increase in outdoor exposure, natural sunlight can help with all these things as well. And loads of evidence has been shown that resistance training has huge impacts on insulin secretion and reducing androgen profile. So yeah, it's really, really important.
Absolutely. So as both a practitioner and a provider, I think this next part you can probably give a pretty good overview on, which is
Yeah.
stress management. Because we know for many, PCOS does not only take a physical toll, but can take an emotional toll as well. So how do you coach patients on their mood and emotional health with PCOS?
Yeah, so I mean, stress is a huge factor that obviously we mentioned right at the beginning. And it's something that when I have that initial call or consultation with someone, I can usually get quite a good judge of what type of person they are and how they potentially manage their stress. But one way in which we specifically sort of like monitor this is by day-to-day tracking of their stress. So what I get my clients to do is actually complete a habit tracking form or habit tracking data every single day, by which point that they will literally rate their stress from 1 to 10, so 10 being the highest, 1 being the lowest. If I can then correlate this with mood, hunger levels, energy levels, we can generally tend to see like a correlation between the two, and the connection between, you know, eating habits and everything else like that. So by doing this daily tracking and the monitoring and then like the weekly check-ins that we have together, it helps me to be able to provide you know, practical steps and not necessarily solutions. Obviously, I'm not a therapist, but there's things that we can do. So simple things like you know, getting out for a walk every day and writing down their feelings and emotions. So affirmations, there's lots of like different steps and things that people can actually take, which we don't often think helps us with things like stress management. And they're free. Like, you don't have to have a therapist to be able to help you with your stress. You don't need to necessarily do all these other wild and wonderful things. There's still lots of things that you can do that can have just as a positive effect on that. So yeah.
Absolutely. Because I think that is an area that is so ignored in PCOS care. And the statistics are astounding with PCOS that 45% have anxiety, 34% have depression, there's eating disorders, mood disorders. And I just think that we have to be more aware as patients and as providers that this is an important part of your overall care with PCOS. So lastly, I wanted to tie all of this together because we are here celebrating the 10th anniversary of Heart for PCOS and connecting PCOS and cardiovascular disease to lower the risk. So how important is lifestyle in not only reducing PCOS symptoms, but optimizing long-term health?
Yeah, I mean, I think it's, again, I don't necessarily think from a doctor's point of view this is given enough attention of the long-term side effects and the long-term conditions that PCOS can lead to. But it's also important that, you know, everything that we've mentioned together, we can literally put it all together and it shows us the whole picture of what can actually help improve PCOS. And for us to understand that it's not just a, you know, a hormonal imbalance or a weight issue. We don't see other areas in which PCOS is necessarily affected. So I think it's really important, especially what you do all the time. And I'm such a huge fan and advocate for what you do. But I think it's important that we all just, rather than working individually, keep, you know, together as almost like a family, to actively try and create this awareness to treat PCOS with an understanding of the long-term effects that it can have, but also with how long-term lifestyle changes can have, you know, a positive effect on it, and that it's not about, you know, quick fixes that just aren't sustainable.
Yeah,
Yeah.
exactly. Because PCOS, as we've both been talking about, is lifelong. It can start in girls as young as 8, maybe even before that. You know, we're still trying to figure out the cause. And we do know that it exists beyond menopause. And even if you have a hysterectomy, yeah, you're still going to have PCOS. So we have to get out of that mindset that it's just about reproductive health. It is an endocrine syndrome, which means it affects pretty much every part of our body, multiple organs, multiple systems. And I think if we start doing that, we're going to have a better understanding of what this is and how to handle it moving forward. So when we're approaching things like androgen excess, insulin sensitivity, and inflammation, are we also helping reduce risk factors for health complications?
Yeah, I mean, everything ultimately that we do, whether it's weight training, walking, swimming, losing weight, focusing on improving sleep, reducing stress levels, environmental factors, everything is going to lead to such a positive and amazing change in cardiovascular health and all other health markers. So I think that's why it's so important to focus on the whole body, because like we've mentioned, exercise, reducing stress, just those two things alone have such positive effects on other medical constraints like heart disease and, you know, cardiovascular, and then just losing weight alongside it. It's so important.
Why is PCOS awareness and joining campaigns like Heart for PCOS so important to you?
I think ultimately because it's my life. Like, I live, sleep and breathe PCOS. Even when I'm not like working, I'm researching or I'm thinking about something that's PCOS related. So I think, like we said at the beginning, ultimately it's my mission to help others and keep creating awareness for the condition and giving women the tools and support that they need to not live in fear of PCOS anymore. Because I know for so many years, like 10 years, I was so scared of the condition and the long-term side effects that it can have, that you can almost kind of brush it under the carpet and ignore it, and then it will always come back. So it's so important to prioritize it and make it, you know, part of your lifestyle to really try and help reduce and manage it.
Yeah. So talking about like fangirling, I have been a big fan of yours for a very long time. And I was so thrilled that you were able to sit down and talk to me today from all the way across the pond. Thank you for doing that. And I want other people to fangirl with me, which I know they're already doing after seeing this interview. So can you please tell our viewers how they can connect with you through social media, your website, or to set up a consultation with you?
Absolutely. So I'm most active on Instagram, and my account is just the PCOS Lifestyle Coach, all one word. And then there's links and stuff in my bio to direct you to my website or to book a consultation call, or just drop me a message. I'm always happy to have a chat and offer any advice or guidance or whatever it might be.
And she is absolutely lovely to have a chat with, everyone. So I would highly recommend it.
Thank you.
Hannah, thank you so much for sharing your personal experience, your expertise, and being part of something that is very near and dear to my heart, which is this campaign. I really appreciate it. And for everyone who tuned in today, thank you so much for joining us. I hope you learned a lot. You gained some new perspectives about PCOS and cardiometabolic health and cardiovascular disease. And I hope you will continue to join us throughout the month of February as we celebrate the 10th anniversary of Heart for PCOS. Please check out our event schedules, our social media accounts, and follow our wonderful, wonderful speakers like Hannah. Have a wonderful day, everyone.